Hey, hello everybody, and welcome to the Curriculum Community and Practice. We meet quarterly to have presentations about things related to curriculum that might be helpful for staff, supervisors, and program managers. Just wanted to let you know this meeting is going to be recorded today. It'll be posted to the website, so you can look at it again as things come up for you. And you can also, other people who weren't able to attend the meeting today, will be able to look at the recording as well. So today we have a very special guest, Deanna Pace, the program manager for Cortland. Her program has put together a lot of curriculum materials that relate to the critical health and safety topics list for home visitors. So Deanna is going to present on these materials that they've compiled, and we'll also be sending out some tools after this meeting in an email, so that people will be able to maybe benefit from that. So I'm going to go ahead and hand it over to Deanna.
Thank you very much. And I am going to attempt to share my screen here. We'll see if I'm going to be successful.
Yeah,
And
we can see it.
okay, there we go. Just the slides? Perfect.
Yep, just the slides.
Okay. So I apologize in advance. When I made this slideshow, it was warm and sunshiny, and apparently that means that now we have to be back in winter weather here in New York State. So we'll just have to imagine the sunshine for today. As you all know, the best practice standards, along with Healthy Family New York policy, require home visitors to share health and safety information, prevention strategies, and areas of relating to areas of concern observed in the home. And we have certain timelines that we have to follow for these discussions. And to make things a little bit easier for my staff, because there is a wide variety of topics, we put together a few different tools. So when do we want to share these topics? And for postnatal families, it's going to be as soon as the baby is born. And we have to kind of prioritize those topics. That clock begins with the first content visit, which is the visit after the frog is completed. Although we can now, with the new policy, share some of our health and safety information at the frog and have it count, which is helpful. Topics are covered within 1 month, 2 months, and 4 months of the content visit. And at our agency, the supervisors print out the critical health and safety list and assign a date for each interval based off that first content visit. And we usually back that up a few days to give staff a little bit of wiggle room in case the family reschedules, cancels, whatever it is that may happen. So for example, we may put a date that's 25 days within the first content visit rather than 30 days for that 1 month group of topics. There's lots of different places that staff can find curricula to support these topics. In our program, we use the PHB and the GGK. So for those programs that have the PAT curricula, I wish I could help you out, but I don't have that curricula. There are obviously other trusted sources that you can go to for handouts. And our program does require staff to get permission before using handouts or information from any source that's not been already identified as trusted if they're not going to go straight from curricula. So this is an example of something from the PHB that would be able to cover depression topics within the required discussions. In terms of sharing the information, no matter what topic, staff at our agency are required to complete initial and ongoing training on curricula delivery that highlights the principles of adult education, encourages them to think about literacy levels and also the family's style of learning. Then we discuss the impact of how information is presented. So we encourage staff to ask families what they know about topics before jumping in. And this allows them to gauge what families may be strong in terms of their knowledge base, and then what areas they need additional support for. It allows them to build relationships through use of reflective strategies. If a family shares that they already have a dental home and know when to introduce toothbrushing and use of fluoride toothpaste, well, then we have an opportunity to give an ATP. If we ask about plans to feed their baby and they talk about bottle propping, well, then we have an opportunity to use solution focused talk. Actually, I mean open-ended questions, excuse me, and normalizing to try to learn a little bit more about those plans and share some appropriate information. Either way, all the curriculas, I'm assuming this includes Pat, include a conversational style that's going to encourage staff to ask questions and then share information. And here is an example from the prenatal GGK. This comes from Unit 5, Module 2, and covers a variety of infant safety topics. It's set up as a game. So we're going to ask questions and gather information rather than the staff member just going in and sharing a bunch of stuff that the family may already know. As I mentioned, we have a wide variety of curricula to pick from, and sometimes that's a good thing. And after the initial critical health and safety list was set out to programs, staff were kind of struggling figuring out what exactly they should share because there are so many different possibilities. And for the GGK and the PHB, curricula is set up to start at the prenatal side of things and then move into postnatal based on age. So figuring out where they should go to find information about a particular topic was taking a long time. Sometimes it was in the prenatal curricula. Sometimes it might be in the first year curricula. Sometimes it's in both. Luckily, we had a very, very good intern working for us when those safety topics initially rolled out. And so I tasked her with combing through all of the curricula to find mentions of health and safety topics. And once we had identified those, we decided we needed to organize this to make it a little bit easier for staff to access, which leads to my personal variation of the critical health and safety list. And so what I did was I modified it to highlight the most important information. And this is based on the new list that came out in February. The first 2 pages, I'm only going to show you 1 page here, but we'll send out the full tool that I have after this is done. But the first 2 pages cover the recommended topics, and different font covers mean different things. So if it's green, it has information on where staff can go to find the curricula. If it's in blue, it's information on where we're going to note it in the home visit log. If it's in red, then that is a flag for the staff to know that this has to be covered within a certain time period. I also have a little spot for supervisors to write the due dates for topic discussions. So the first 2 pages kind of look like this because these are the required topics. And then that third page, which is the recommended topics, I actually have that font kind of in gray because I want the staff to focus on the required items first. And I was finding that before I did that, staff were kind of skipping to those recommended topics first and not hitting those required topics. And then we weren't meeting the guidelines. After we created that particular tool, we scanned in the curricula and handouts to a critical health and safety folder, which is on our shared drive that is subcategorized by due date and then topics. So for instance, if a staff person needed to talk about safe sleep, first they would go to the required 1 month folder. And then within that, they would click on the SIDS and safe sleep folder, and that would pull up a variety of curricula or trusted handouts that they could give to the family. And some other things, these are some other things to think about when you're working to support staff in sharing information from the health and safety list. This is very hard to do, but if you can do it as a supervisor or program manager, I would highly encourage you to become as familiar as possible with the curricula. Take the training if you can. The more you understand about the curricula and where things are, the easier it is to kind of guide staff if they're struggling. But if not, figure it out together. Practice at team meetings, practice in supervision, check in on how rapport building is going, check in on how staff are experiencing meeting those health and safety topic deadlines. How are they doing with their pre-visit planning to figure out which curricula they're going to use? And another idea you could consider, which I'm working on, haven't gotten there yet, is creating some kits for staff. They'll be grab and go kits with activities that they can use to support their discussion of health and safety topics. And I am going to stop sharing my screen here and show you an example. This is from way back. I'm assuming it's still somewhere in the GGK. I just didn't get a chance to double check to see if it was on my list. But this is a health and safety box that one of the makeable projects, and inside have all these little pictures. So this would be about tub safety. We have one on healthy eating. This is a bag of chips. So there's lots of different ways that staff can share information without necessarily having to talk at families. And that's what I've got for today. Questions?
Wonderful. Thank you so much. That was a fascinating presentation. It's really inspiring how much work you've done to match your curricula to the critical health and safety topics list. So we welcome questions from the audience. Does anyone have any questions for Deanna or comments that's familiar about your own experiences with this?
I have a question for Deanna, just for clarity's sake. When you say take the training, are you talking about the training for the curriculum like GGK or PAT, or are you talking about a special training for the health and safety checklist?
So I was referring specifically to curricula training. So if there's a GGK training, take it. If there's a PHB training, take it.
Gotcha.
Yes.
Thank you.
And I'll just clarify that PHB is Partners for a Healthy Baby, which is put out by Florida State. So sometimes people call that the Florida State curriculum. It's the same thing. Some comments in the chat. I love the streamlined nature and accessibility. That's great, Deanna. What a great resource.
I have another question. So Deanna, you said you're going to send out your color-coded sheet. Are you sending it with the key so we can remember what the codes were?
I will make sure that it includes the key. I'm going to write that down right now.
Perfect. Thank you.
Another comment, having everything in folders accessible to all staff is a great way to help us all be on the same page. That's great. Oh, someone else says, we made a binder for each area following the checklist from all areas of GGK. Great.
I was going to say, you guys have probably already done some work and had some, other ways to do this that may be really beneficial for everybody else, including myself, to hear. So I'm open to new ideas.
Actually, I just wanted the example of the GGK prenatal. Is that from the new generation?
That is the new
Okay.
prenatal. I spent some time. I was actually working on going through to see what still matched up from the old GGK to the new GGK prenatal when I was asked to do this. So it worked out perfectly because then I had to get it done a little bit faster. So everything is from the new GGK.
Okay, okay. That's good to hear then.
And if you haven't had a chance to leaf through the new GGK prenatal, it really is very, very nice. I like a lot. They've put a lot of changes into things. There's a lot of activities for families to do that are going to build on their knowledge, but also obviously are going to build on that parent-child interaction piece before the baby's even born. So I'm really, really happy with the changes to the prenatal. Oh, a health and safety bingo card. I love that.
That's great. Heather, if you'd like to share that with everyone, you could send that to me and I'll put my email address in the chat just in case you don't have it, and I can send it out when I send out Deanna's materials. Thank you so much, Heather. That sounds like a great resource. Does anyone else have any questions or any experiences you've had with having some difficulty finding resources to support the critical health and safety topics list?
I guess I just have a question. So the fetal alcohol syndrome, I feel like there's not a lot to cover it. Sometimes I have to go to like a source. Like I love the Mayo Clinic sometimes because they have a lot of good things, but I feel like there's not a lot for that.
Interesting.
I'm just going to look and see what I have on that particular topic. So bear with me. So it is there. So now that I can get back to see your faces. I did find some stuff on Curricula on discussing the fetal alcohol spectrum disorder in the PHB itself. And that is, if you want to know, if you haven't looked there already, so PHB, Florida State University, it's in the baby's first year book and it's handout 11. And then the other place we were able to find some trusted handouts for fetal alcohol spectrum disorder was a handout from ACOG, which is the American College of Obstetrics and Gynecology. So those are two places that we did find information for FASD.
Great. Thank you so much, both of you, for sharing. Oh, Kara, do you have another question?
So, hearing during the presentation, we should get things from trusted sources, right? But do you have a list of what you would consider trusted sources? Because ACOG definitely, but that's such a broad phrase that they can come and say, well, I feel that this source is trusted. What is helping you to differentiate between non-trusted and trusted? And if you can list some that you think are trusted.
So for me personally, I'm gonna think places that have either are backed by doctors or are backed by scientists. So ACOG is definitely one. American Academy of Pediatrics, the healthychildren.org website is another. CDC. I'm trying to think of some of the other ones. Let me just scoot through here and see if I can find some other ones that are New York State Department of Health, obviously. Sometimes you have to kind of watch the handouts in terms of the literacy level, and the ease of presentation, but that's another good one as well. Obviously, Prevent Child Abuse America, Prevent Child Abuse in New York, anything they put out is going to be good. OCFS. Those types of places are typically the places that I'll look for. And then sometimes major universities that have some sort of very big research arm attached to them. Journals that are peer reviewed. That's my personal opinion. Those are kind of some of the things I look for.
Thank you so much. That's helpful. And then just looking at them and think about education level, right, before we share them out. Thank you.
Yes, thank you. That's really helpful list. Does anyone else have questions or comments? I will be sending out a link to the recording for this presentation today, and Deanna's tool and the PowerPoint presentation for everyone who wants it, and then also Heather's bingo card now. So you'll get that sometime in the next week or so, once the recording has been posted to the website. Does anyone have?
Do you know around when will the recording be posted?
I don't know exactly when. It depends on when our IT people are able to post it. So sometimes they're very busy and they don't get, it should be within the next week. And when it is posted, I will send out an email with a link to that recording. So you'll get an email from me. Everyone in the HFNY network will get an email from me. So you can look out for an email from me, Miley Ray.
Okay, thank you.
Okay. And it will have all of those tools along with it. Does anyone else have questions or comments they'd like to share with the group? Experiences you've had?
I was just looking at some of the stuff in the chat. I feel like I do somewhere have a list of trusted websites. I'll just have to make sure it's updated. And I'll send that to Maylee as well. And
Okay,
then that
great.
will be
Thank
shared
you.
out with the group. And then I saw somebody was asking about videos. And we actually just took a training through our local health department, and they had some really good videos on immunizations that might be helpful. So I will try to send those links to Maylee as well.
Okay, great. Thank you. So if anyone has any questions or you would like to present at a future community of practice meeting, just email me. I put my email address in the chat. My name is Miley Ray. I work at CHSR, and I'd welcome additional presentations. This was really great today, Deanna. Thank you so much for coming and presenting for everyone, and thank you all for coming to attend. We have about 75 people on the call, which is amazing.
I have another question, but this is
Oh,
general question, since I
sure.
have a forum. I'm hoping that somebody can help. Do you all know of a source that I can get that produces like a welcome mom kit or a welcome baby kit that we can order and a welcome dad kit? Figure there's 75 of you all in here.
I'll open that up to the group. Is anyone aware of anything like that? I'm not.
Kara, are you talking about resources that you can give to a parent as like in a first home visit to engage them and to bring them at the first visit? Okay. Well,
As well as if they've been in a program, that's one set of gifts I'm looking to do. But also if they have a baby, they're in the program, and now that they have delivered, to be able to say, welcome to the new baby. Yes.
okay. Well, in our program, we have in the past we had one of our partner organizations, the Adirondacks Foundation, had put together some family kits, and some people in my program are here, so remind me about the name of it. Is like baby kits, anyways, and they put together these
Baby
bags.
bundles.
Baby bundles. Thank you, Holly. Yeah,
No
they
worries.
were called baby bundles, and those baby bundles included a bunch of different resources and stuff. So one of those things that came in that was when to call the doctor book. So that was a really good thing. And then there was some like a little onesie that says, let's talk about baby or something like that. Things that a new parent will be able to use, right? And list of resources for the community depending on what county they were. So those were really helpful. They were funded through the Adirondacks Foundation, and they provided it to us and other resources in the community to give to first-time parents. Then the money ran out and we didn't have them anymore. So then we were left to create them ourselves. And it just so happened that we have been working on putting together, but I cannot tell you that there is a place where you can just Google Amazon and say baby kit or whatever. We have put them together depending on what we need and what our program is able to offer. So we have ordered bags with our logo and like baby towels and with our logo, everything with our logo to market our program, of course, and little baby t-shirts and other supplies and stuff that we can give the families, including that book, because that book, seems to be super helpful. And it comes in English and Spanish too. So maybe in another language as well, I'm not sure. So that's one thing that we put together for like a welcome family visit, we call it. And then for follow-up visits, once we are engaging, there you go, Holly's showing the video in her this, what to do when your child gets sick. It's not when to call the doctor. Yeah. So that's it. Thank you, Holly. And I think and then we put together other bags for later on to engage them in different things and at different times. But I don't know if that helps you. Sorry.
That totally helps me. That totally helps me, and I'm very, very grateful. I figured I'd open. I'm sorry, Miley, if it just wasn't on the topic, but I
Oh,
knew
no, absolutely. Go
it's
ahead,
a
use this
forum.
forum.
There is also, I knew that there was a lady that used to do things for healthy families with the logo, and I don't remember her name. If anyone remembers who I think it was a Susan, but she would be the person that did a lot of the logos for healthy families and put it on um, paraphernalia. And if anyone can remember who that person is, if you can send it to me, that would be great. I think her name was Susan, though. But thank you very much, Esther. That was super helpful.
Yeah, thank you, Esther. That was really interesting. And thank you, Holly, for sharing that book. Does anyone else have any questions? It doesn't have to be directly on today's topic. If there are other things people would like to discuss and just have questions about for the group, it's a nice large group, so maybe it might be helpful to people.
Actually, I have a question. And this is a little bit about my experience. Talking about, the health and the safety and health checklist, like when we talk with parents about um when to start the complementing eating or, solid feeding, and we have the information that pediatricians recommend at 6 months. But I am having some conversation with some parents where their particular pediatrician is recommending to start at 4 months. So it kind of starting to sound a little contradictory. I always tell them, I'm not a doctor, the doctor knows, but then I come with this information and then hearing their experience, um, I sometimes feel like, oh, okay, I don't know if my information is not up to date. What is going on? I don't know if anyone else has experienced this, or what are your thoughts? Because I sometimes just feel like, well, I had the conversation. I spoke with the family, and I'm hoping that the pediatrician, knows. I don't want to say it like that, but that they know what they're guiding the family.
I know that the AAP and WHO guidelines do recommend exclusive breastfeeding up to 6 months. They still currently recommend that. But I'd be really interested, there may be reasons why a pediatrician would recommend complementing it, like if the mother's milk is running out, if she's not able to feed the baby enough, then you need to complement with formula or other foods. Or, if it's difficult for her to pump and she has to go back to work or something, there might be like circumstances that prevent her from continuing to exclusively breastfeed. Does anyone else have any thoughts on that? Yeah,
I've been
I will go
I've been
ahead.
running into the same issue with my families. Well, it's not an issue. The doctors have been changing it from 6 months to 4 months, depending on baby's development.
Hmm.
And they have been okaying them to start solids very slowly. Um, and that's been my conversation because it is 6 months in the books. Um, so I do just if the doctor is okaying it, then we just start chokes of solids from then. But I've been having the same thing with a lot of my moms. Like there was a 4 month baby just now, and the doctor okayed mom to start him on baby food slowly. So I've been feeling how Bonnie has been feeling. Like we're going in there with these books and we're telling them 6 months, but then the doctor is like, oh well, the doctor said we could give the baby food. So I just been like sort of adjusting, like I feel like it's something that's gonna probably change and books will modify it in some way. So I just go with what the doctor says because the doctor okayed it and just still teach the curriculum with starting solids regular earlier than 6 months.
I think we do work with recommendations. However, there are also, as you mentioned, Miley, there are things that can change and vary, and the physician is the one who is really trained to decide what it's in that time right for that family. So I would never really contradict the indications from a physician because that's is out of our scope. However, definitely like explore maybe with the family what have the pediatrician advised them or shared with them, and just go along with it because working with the information we have, that's always going to be recommendations, but there are changes. There will be variations according to from family to family, and that's out of our scope to kind of determine otherwise.
I wanted to add on to that as well. Like I've been having, actually, I have a family that she has a preemie baby, and something that as well was that I learned, and at that point, like I just let the family, like you said, go with what the provider is telling them to do. Like their answer is correct and do it like how they telling them to do it. I have a mom that she mixes her breast milk with formula because the doctor for the baby could get like some weight. So the doctor had like that's the way. I never heard that before that you mix breast milk and formula. So I didn't really like have that information with me. And I thought she would say like, no, first I'll give the breast milk and then I'll give the baby formula. But it's like both mixed together. And like me, I came into the conversation, the WIC breastfeeding specialist as well, because we were like so confused about the information. So I'm just guessing like there's a lot of changes going on when it comes to feeding the baby and how they're doing it now. I believe so, but I never even heard of that. Like, so I let the mom like educate me in that kind of information.
Yeah, that's really interesting. I was just looking at breastfeeding guidelines today for a project I'm working on, and it does say, I did read that the AAP and the CDC and the WHO all recommend exclusive breastfeeding to 6 months and breastfeeding some amount up to 2 years and even longer. But yeah, I think you do have to follow the doctor's recommendations. You certainly don't want to contradict what the doctor is saying and have it become like a tension with the, it's very interesting. I wonder if there is a trend somewhere to reduce the time recommended for breastfeeding.
So I'm just going to throw on my WIC hat here because I worked in WIC for many, many years before coming over to Healthy Families. And this is not anything new. We heard this for a very long time. Some of it is just like we have families that we work with that have particular cultures and information that they know historically. We do sometimes have those similar cultures when it comes to physicians. My understanding, and I am not a doctor, but my understanding is that they may not get a solid training in nutrition like we might expect them to, because there are so many things doctors have to learn. I mean, if you look at that book for the exams that they have to take, they have to have basic knowledge of everything. So they don't always get in-depth information on nutrition and feeding practices. However, we do not know a child's background in terms of their medical history and other things that may be going on. So you do have to take it with a grain of salt. You do always have to defer to the physician. But it doesn't mean that you can't encourage a family to, if they're not understanding or they have questions to go back and ask their pediatrician for clarification, because there are things that have to happen in order for infants to be ready to eat solids. They have to be able to sit up by themselves, and they have to be able to swallow without having that reflex where they spit everything back out, the tongue thrust reflex. Those are some of the things that are required in order to start solids. Some babies hit those milestones early, so they can be more closer to the 4-month range versus the 6-month range. And we may not always know those things. So again, double checking, but always deferring to the physician, because they are definitely the expert in terms of the baby's medical history and the baby's health.
Thank you, Deanna. Oh, Liz Mary, do you have a question?
No, I don't have a question. I just wanted to share that as well with the feeding process too. No.
Okay, does anyone have anything else that they'd like to share or ask the group or comment on? Okay, then I guess we'll end a few minutes early. And you be on the lookout for an email from me in the next week or so with some of the tools that were shared with us today, and also a link to the recording, which will be on the website under the curriculum page on the staff side of the website. Okay. Okay, well, thank you all so much for attending. It's been great having you. And thank you, Deanna, so much for your presentation. It's really interesting and very impressive that you're so organized with putting all of that curriculum materials together for this. I think it will be really useful for a lot of other programs. Okay, thank you, everybody, and have a good day. Hopefully the weather gets warmer soon.